I'm great. Thank you so much for having me. Like you said, things are happening in Ontario, Canada, and as a speech language pathologist, we were super excited to be named a number of times in the Right to Read report because speech language pathologist, anybody listening out there, we have been shouting from the tops of the mountains about some of the foundational skills for reading and writing. So I'm happy to be here to chat with you.
Wonderful. So I think we should start out by just defining what a speech and language pathologist is, because I think there's a lot of misinformation out there and that some teachers don't really understand how it applies to their classroom.
Absolutely. And I think we should be called communication literacy sociologists. The title of speech language pathologist certainly can be misleading, and people often think that we're just, immersed in helping kids that have a frontal lisp or can't say R. However, we are regulated healthcare professionals with a master's in communication disorders, and we're trained in all areas of communication from birth to death. So anybody that has any kind of communication need, that's what speech pathologists are trained and specialized in. And so when we think about communication, there's so many facets of communicating, but the four main modes that we communicate, although we know there's nonverbal and all of those other things, are speaking, listening, reading, and writing. So as an educational speech language pathologist, I'm embedded in the education, providing support around those areas of communication across all tiers. So we do educator workshops, we work one-on-one with teachers, we work with ECEs and EAs and principals to build capacity around supporting those areas of communication, as well as in-class support, delivering one-on-one instruction and around speech language or literacy needs. So that's just one of the settings that we can work in. Speech language pathologists work in hospitals, they work in long-term care facilities, they work in private practice. So like you said, I'm a private practitioner as well. And I work one-on-one teletherapy with students, supporting communication and literacy and doing parent training.
Wonderful. Well, there's such a huge value in speech and language pathologists. I have 3 children of my own who have all benefited from SLP support in the early years and as they're growing up for various different reasons. And I think one thing that's really important to realize that when it comes to reading and writing, we need to first consider that oral language foundation because it lays the starting level for understanding what we're reading and being able to really distinguish the sounds in the spoken word. And when we're talking about English, which is a morphophonemic language, so that means that our spelling system has parts that relate to the morphemes, which are larger speech or larger units of sound that have tied to the meaning of the word, but it's also phonemic. So those are the individual speech sounds within the spoken language. And so many of our kiddos struggle with those, even if they are first language speakers.
Absolutely. And what you're saying about oral language being the foundation, as speech language pathologists, we know that learning to read and write doesn't start when kids start actually being exposed to the print. Learning to read and write begins in the womb when kids are listening. Babies are hearing speech sounds in the womb, and then they're immersed. And, human beings are so unique in that our brains are hardwired to learn oral language and to be immersed in that language and to learn the meaning of a word. And then the foundation for reading and writing and the connection is that sound map associated with that word. So, in order to be able to read and write, we need to be able to hear speech sounds, like you said, and then attach the print to those speech sounds, because written language is essentially just speech in print. And more specifically, it's individual speech sounds with a letter or letter pairs, a grapheme attached to it. So when we're looking at the development of oral language, we know how important it is for kids to be exposed to rich language, so that when they can eventually sound out a word after they've learned some of those skills through explicit and systematic instruction, they have the meaning that pops up in their head, and all the context that they've learned the meaning of that word pop up in their head as well.